It's my great pleasure to be able to introduce our three panelists. Let me begin with Arden Crystal. Arden Crystal is the president and CEO of South Lake Regional Health Centre in Newmarket, Ontario. Arden started her career as a registered nurse in medical and surgical oncology. She has a Bachelor of Science degree in nursing and a Master's of Health Administration, both from the University of British Columbia. Arden has also completed the Managing Health Delivery Certificate program at Harvard University. Prior to her arrival at South Lake, Arden held senior executive operations roles at two of the largest health authorities in British Columbia, the Fraser Health Authority and the Provincial Health Services Authority, with responsibilities spanning the full continuum of care, including public health, acute community, tertiary, and quaternary research and academic organizations. Her portfolios also included responsibility for non-clinical services such as quality risk and human resources, and she has overseen as clinical executive sponsor major public-private partnerships, or P3, capital projects in the hospital sector. So please join me in welcoming Arden Crystal to our panel. Next, we have Connie Clarisi. And Connie is the executive chair and founder of Closing the Gap Healthcare. Connie began her career as a registered nurse with a Bachelor of Health Science in Nursing. She has continued to prioritize lifelong learning and routinely participates in leadership and business training programs at Ivey, Rotman, and Schulich Business Schools. In addition to her role as an adjunct professor at the University of Toronto's Institute of Health Policy, Management, and Evaluation, Connie sits as a board member or advisor at the Ivey Business School, Ivey's Pierre Mosseret Institute for Entrepreneurship, Salus Global Corporation, Women of Influence, and Trans Research Labs. Connie's contributions to healthcare, entrepreneurship, and the business community have been acknowledged through numerous awards, including the 2012 Mississauga Board of Trade Business Award of Excellence and the Queen Elizabeth II Diamond Jubilee Medal. Please join me in welcoming Connie. Esther Mogadam holds the dual roles of Chief Nursing Officer and Director of Health Promotion at Ottawa Public Health. She also serves as an academic advisor with the University of Ottawa School of Nursing, an advisor for Loyola da Silva Chair in Public Population Health Risk Assessment and Management. Please join me in welcoming all of our panelists.
Thank you very much, Vanessa. Sorry for that delay. I think we're all adjusting to this new world of virtual conferencing. My name is Arden Crystal, and thank you so much for inviting me here today. There is no, I don't think anybody would argue with me when I say our world is changing, and in so many ways. And start my video just a minute. I want to make sure I'm good. Okay. And it's fueled by a global economy, advances in technology, changes in cultural beliefs and values, and of course, presently by the COVID-19 pandemic. And it's often a challenge for public services, whether that be healthcare, education, governments, to be nimble in changing. We are so often reactive instead of proactive. And let's face it, change is hard. However, we know that when faced with a true crisis like COVID, most people are capable of changing quickly. They just need a burning platform. And our job as health executives is really to set the stage for change, to identify those burning platforms so that our organizations can come aboard. Artificial intelligence is one of those advances that we need to prepare for. And it's something that in fact has already been quietly infiltrating healthcare for some time now. Whether it is predictive algorithms programmed into triage software, wearables that alarm remotely, or the simulation software we utilize in our own RN simulation training labs, AI is not going away. In this session, I've been asked to focus on how executives should be inspiring and supporting AI in clinical practice, So I'd like to focus on the impacts to the delivery system, how I think nurses' roles will need to evolve, and what executives can specifically do to advance adoptions. All of that in 5 minutes. So here we go. First of all, impacts to the healthcare system. Global shortages of trained professionals have really added steam to the already burgeoning knowledge economy and the rise of technologically based virtual care, things like machine learning. We know that aging populations and longer lifespans are going to continue to put pressure on the healthcare system, requiring new ways of providing care. We're not going to be simply be able to take care of everybody in a hospital or a long-term care facility. And costs are rising, and that really necessitates new ways of working and less variability in cost structures. And using AI can provide potentially more predictable care processes and outcomes. And this predictability often reduces costs. So how will a nurse's role change? Well, it's my belief that nurses' roles are always in some state of change, given the outside forces in healthcare that we're susceptible to, whether it is increasing patient and family engagement in care, which has served to increase the teaching and mentoring role of a nurse, whether it's increased technology, which changes the way nurses assess and intervene with patients, or whether it's learning to work in team-based settings where all providers work at top of scope. With the adoption of AI, what I think we're going to see is that the nurse becomes the information integrator, the health coach, and kind of retains that human touch. I don't think we're going to see robots all independently doing nursing care. But, and so AI is not going to be supplanting nursing, but it will be supporting decision-making in a big way, which ideally should free up the nurse for other activities. An example of this would be maybe the use of machine learning and predictive analytics to proactively intervene with patients before they deteriorate in a much more robust way than we already do. We have teams that go around to try and anticipate a patient's needs before they code, but we're still a ways behind and probably getting ahead of that as much as we could. So leading the change, as I'm sure you all know, and as I mentioned in the intro, the first step in enacting any change, especially those kinds of changes that directly impact someone's job, is to make the case that change is needed and unavoidable. And it's likely that nurses and other care providers will react with some level of skepticism, fear of job loss, and fear of losing that personal touch. So as leaders, I think there are some things that we can do to make this happen. First, I think we need to ensure that we cultivate a growth and innovation mindset in our organizations. That means taking some risks, supporting failures, and setting some stretch goals. I think second, we need to share stories of usefulness. For example, how technology and AI support the nurse to make faster and better decisions. And we do have some data to back that up. It's a growing data pool. But one of the things that we know about adult learners is they need to know the why behind the change. And so these stories of usefulness would be very important. The third thing I think we can focus on is time. I mean, we know that there are a lot of studies out there that indicate that anywhere from 10 to even up to 20% of a nurse's time is still occupied with so-called non-nursing duties. And how can AI help the nurse regain some of that time? And the last thing, really help nurses adapt to becoming more of a coach as opposed to a doing role. And we're going to have to implement some more education to help them adapt. And, I would say for sure that communication is key here. We need to be transparent and honest. We need to answer questions to the best of our ability as leaders. It really helps to provide, to establish trust and to prepare them for the change. We're going to have to be tenacious, constantly reassuring and providing reinforcement and follow-up. We all know that new ways of working take significant time to take hold. Most change initiatives fail not due to the implementation themselves, but to the lack of follow-up to make sure that the change is stuck. And above all, lead using the shared values of the organization, be honest, try to lessen the unknowns, to reduce people's anxieties, and to recognize and support losses while also praising successes. I've always found that it's okay to admit that you're sad to be losing a way of working, and that you have to enact staff changes. It doesn't mean that you're admitting to not supporting the change. It just means you're human and has feelings. I think that resonates with staff, and I think you need to listen to the staff sharing those feelings as well, and sharing their ideas for how this can be a more successful change as you move into adopting more AI. So to close this short introductory talk, I'm excited about the changes yet to come in healthcare. As a nurse executive, I think it's going to be fun to play a role in leading these changes. And I look forward to the rest of the panel discussion. And I look forward to your questions. So thank you very much for inviting me to participate. And I'll hand it back to the next speaker and look forward to your questions. Thanks very much.
Good afternoon, everyone. First, I want to thank RNAO and AMS for the opportunity to speak about artificial intelligence and compassionate care on this panel of esteemed leaders. I will be speaking about artificial intelligence in the home care sector. Over the course of my career, nurses have adapted to the introduction of multiple technology solutions. We have consistently demonstrated our passion for humanity throughout the years of constant change in healthcare. We know that implementing accountable care requires that we marry artificial intelligence with compassionate care. In my experience, it is tempered leadership, acting with integrity while collaborating with all stakeholders that has formed the foundation of success while introducing AI. As leaders in the home healthcare sector, we also need to understand the importance of ensuring that AI is married with the frontline delivery of compassionate care. This is a significant but essential shift. AI should be used to maximize the impact and effectiveness of human interactions between patients and healthcare providers. It should not be viewed as an alternative to a human interaction. As healthcare professionals, we need to understand that electronic systems are simply tools that should enable the care process. We've only begun to scratch the surface, and there's lots of work and opportunity that lies ahead. The public is asking and often demanding improvements in accessing care and services. This includes modernizing how we deliver care. Clients and families need to be active partners in the interventions and not passive recipients of care. Particularly in home care, where there's so much diversity in how people live their lives. The home care workforce is a mobile one that is also geographically dispersed, so our teams rarely interface face-to-face. Perhaps more so than any other sector, care delivery in the community can be enabled to work in a team environment across the continuum, though through connected information systems. All clinicians involved in the episode of care would then have access to the same clinical information in real time. The expansion of virtual consultations would enable all frontline care providers at the bedside to access the clinical expertise of nurses who have specialized training in areas such as palliative care, wound care, infusion therapy, and cancer care, just to name a few. These clinicians would also have the required expertise in the most up-to-date best practices and specialty certifications. Going one step further would be to grant patients and families access to information and to offer greater influence in areas such as scheduling, frontline worker identity and qualifications, and input into the development of care plans. Enhanced monitoring could minimize risk by improving the ability to identify early issues that can reduce ED visits, impact recovery, or identify new health challenges. This will require clinician autonomy to determine benefits of such monitoring, along with the trust of both clinicians and patients that this level of monitoring would produce positive health outcomes and reduce the financial burden on the sector as a whole. We must increase awareness within the healthcare system, especially among system leaders, on the need for investments in modernization to achieve gains and improve outcomes for the healthcare system as a whole. I would be remiss if I did not mention the need to focus on the health human resource capacity challenges we face. With the average age of a registered nurse hovering around 45 years, we must think about how we actively transfer knowledge and support younger clinicians while modernizing care delivery. There is a role for expanding AI in home care to assist with this issue. We are all aware that seniors' care and the complexities we face with comorbidities is real. We must be able to deliver compassionate care in this new world where artificial intelligence will soon be a core service within all modern home care delivery systems. Clients and families will require education on the use of technology to ensure it's correctly utilized and that it provides the necessary confidence to all stakeholders to allow for home and community-based care. AI will also assist with managing HR capacity and service volumes through the introduction of new models of care that safely meet the needs of every patient in a safe and ethical manner. Safe care is the best care. Through the use of data analytics and promoting clinical involvement in the development of information systems, we will ensure better care is delivered and better outcomes are achieved. Working collaboratively with IT specialists, but also promoting the role of health informatics specialists will ensure systems are best designed for good care. During COVID-19, virtual care options allowed safe care during a pandemic, along with the better use of the reduced health human resources for certain types of care. This allowed organizations to leverage specialty staff. In the longer term, AI will enable meaningful process data. If standardized nationally, Canada is far behind other jurisdictions in this area. The data collected will better enable research and subsequent informed decision-making that will provide a path to better health outcomes, accountability, and transparency across the country. Standardized information at the point of care will also allow for better quality and patient outcomes measurement that will inevitably improve the care that is delivered. Home care would benefit from the expert opinions provided by RNAO and AMS on how to improve the care journey through the successful marriage of AI and compassionate care. Positioning technology in the context of compassionate care requires ongoing rigor and focus to reinforce this perspective and realize it at scale. Our public funders' investment in AI and home care has been negligible and largely been limited to the referral process. The reality is that care is delivered by home care is delivered in the home by providers, and the information at the point of care is valuable data and is where health outcomes can be most influenced. Government investment is urgently needed. Thank you very much for allowing me to present and for considering my opinion.
Good afternoon, and thank you so much for this invitation to speak and to be part of this distinguished panel and symposium with, I think I saw over 200 participants. I am so pleased to be here to add a public health nursing lens to our discussion on nursing leadership considerations with the integration of AI into clinical practice this afternoon, and to add to some of the recommendations on how we can all move forward together. I do need to state up front that my views and opinions on this issue do not necessarily reflect the view of my employer, Ottawa Public Health. So in public health, we spend a lot of time trying to understand what makes some people healthier than others. And according to the WHO, lifestyle contributes 60% to health. That's, of course, a huge number, making this a top priority in our population health efforts. Now, there is no doubt that AI has a role to play in the health promotion space. And you just need to look at Google and see how quickly they've moved moved aggressively into healthcare and wellness areas. Right now, there's some really great AI already in our smartphones, our vehicles, and on our wrists as Fitbit watches, helping people manage their health and understand more about personal wellness issues that public health cares about, and of course, we all care about. And municipal, provincial, and federal governments are loving it, but not necessarily for the right reason. So here is where I'm going to get a bit controversial. Without strong leadership, I think the health of populations, I don't know if they'll be better off with AI. I have not seen strong evidence that AI is going to solve our population health challenges just yet. Now, having said that, I do want us just for a second, imagine the pandemic if we didn't have Zoom and other technologies to support virtual care. It would be a very different pandemic with even greater barriers to care and even more severe economic impacts. So I'm not disputing the technology. It's a new leadership lens, I think, that will be needed to implement, to impact rather population health levels with AI. So I just want to talk about two examples. The first one being the COVID Alert app. Canada's release of the COVID Alert app was greeted with great praise and fanfare. Many of you have likely downloaded the app on your smartphones, of course, depending on where you live in Canada, because not all provinces have agreed to sign on. The COVID exposure notification tool, like the Health Canada app, I think has limited value in the care process. It doesn't allow public health to identify people who have been exposed to infected individuals, and the app itself is prone to false negatives. So while you can argue that that this is a step forward in contact tracing, I think the real problem with the COVID app is that rather than targeting the groups most vulnerable to COVID transmission, it focuses on those less likely to spread COVID, namely those who can afford smartphones, data plans, and are not living in dense congregate living conditions. I'd like to talk about a second example, this one related to healthy eating and active living, and focused on lifestyle, and this is Google. So as I mentioned, Google is entering the space in a big way using the science of nudging. With a Google AI platform, you no longer have to make an active choice to exercise or even how to eat. Google will record your current behavior and through your watch or your phone, nudge you to walk more. Now, from the perspective of government, this sounds wonderful. Wouldn't it be easier if public health could just tell everyone through Google to eat more vegetables and walk more? And a new type of behavior intervention would be possible to solve obesity. And some people are actually thinking that this is a reality. However, it's one thing to be told by an app to walk more, but it won't solve the problem of infrastructure if there is no place to walk. If we're serious about healthier options related to healthy eating and physical activity, we all know that we need to have access to fresh food, design walkable communities, and design buildings to promote stair use, tax unhealthy foods such as pop and other sugar-sweetened beverages, and ban advertising to children. Now, I think AI will allow us to have some very sophisticated and original interventions in everyday life that will promote health, but it's not going to fix everything by digitally quantifying, tracking, or gamifying our health promoting behaviors and improving the health of populations. But having said all that, I am cautiously optimistic about the future of AI and have three closing thoughts. So where I think strong leadership will be needed if we move forward, or as we move forward, because I think that's, of course, a reality. Number one, we need to be, as nursing leaders, we need to be very clear about the problem we're trying to solve with AI and even understand how it became a problem in the first place. Ensure that the problem is well understood. That's so critical. Identifying a solution without fully understanding the problem is not good. Technology will become a trap. I think if we focus on the technology's design rather than its effect and impact on the population it was supposedly designed to address, we're going to have we're going to have a lot of disappointments, false starts, and it's not going to be the panacea that I think some of us think that it may be, and such as our experience right now with Canada's COVID tracing app. Number two, we need to focus on the benefits to all people, not just a few. So this, I think, will require us to ensure nurse and client involvement in the design and development of AI tools. We must ensure that AI benefits client care, particularly for those that face the greatest barriers, risks, and low levels of technology literacy. Nurses can bring the client voice to the table, but it's even better to have clients themselves at the table. Nothing for me without me. If it can't work for all, at the very least, AI technology tools must work for those who need it the most. Then lastly, I think we need to appraise and understand where AI can be reasonably applied. The belief that that AI is a cure-all tool that will magically deliver solutions to solve population health problems like obesity is misleading, and I'm afraid will prevent other more effective solutions from being implemented earlier or even explored. Evaluation is a component that just can't be forgotten. Thank you, and I look forward to your questions and panel discussion. Back to you, Vanessa.
All right, we're back. Thank you so much to our three panelists, to Arden, to Connie, and of course to Esther for those very interesting insights across three different sectors, Arden in the acute care sector, and Connie in the home care sector, and Esther from the public health sector. So I think that's, it's an enriching opportunity to have colleagues today from across all sectors to provide their views on this most important topic. One of the things that I want to do before we get into, I'm sure you have lots of questions, but let me just go back and summarize what I think, and I hope I do justice to all of you when I summarize for the audience again some of the key points that I took from your respective talks. And let me begin with Arden's talk about the implications of AI that's quietly but steadily been infiltrating the healthcare system. And I love the way Arden put that, because it's so true that there was a point in time where it was a very subtle, quiet infiltration, and now we see sort of the explosion that's starting to happen. And ergo, the reason why I think this symposium today is so important. Arden talked about the health system impact and about issues regarding supply of health human resources and new ways of delivering care, and how all of that is significant through this infiltration of AI. She talked specifically about how this is affecting nurses, and that one of the things that nurses will need to hold on to and must hold on to is the aspect of coaching, the art of being able to interact with others on that level to maintain the sense of human touch and the spirit of compassion. And then the other really significant piece is, of course, around change management, and how all of us as leaders and in general will need to be able to understand where we will have to intervene to shepherd these changes into the system. And then Connie talked to us about what I think is a lovely statement about how AI needs to be married with compassion in frontline care, not as an alternative, not as a replacement. It is simply one of the tools now that we have to accept as part of our practice, as part of care delivery. So I think that was a really nice way of putting it. And Connie also talked about how at the end of the day, if we have healthcare technology, AI that becomes useful and really doesn't interfere with our ability to deliver continuously compassionate care, that the data that we can derive because of these technological systems will be very helpful in improving health outcomes, in building better care paths for people. And so those were the key points I took there that I thought were really important. And Esther, from a public health perspective, I loved the comment that you made about AI will not solve our population health issues. My own background, I have the public health background from many years ago. And I think that that was a really strong and important point that you made. And then Esther gave a couple of examples around this, the COVID-19 alert and Google, and how they're using Google applications to nudge people to do certain things to increase behaviors in certain areas. But I think that the real takeaway from Esther's talk was the fact that we will need strong leadership to really understand what the problem is that we're actually trying to solve, and whether or not AI can in fact be used effectively to solve that problem. Esther alluded to the fact that she doesn't want a diversion from development of solutions to the real problems. And so I thought that that was a very interesting take on that. Did I get that right? I hope I summarized well for all of you, but I mean, for me, and I'm sure there are many other incredible takeaways from your talks, but I wanted to start with that just to remind everybody of what I think are some of the salient points across each of your respective talks. I want to ask that if you have questions, please feel free. I invite questions into the chat box. I hope I said that right, Rita? Rita and I will do the best we can to identify those questions and read them out so that we can ask the panelists what their opinions are around them. And I have the first question now from the audience. And the question is, how could AI support workflows for transitional care models that support patients and family engagement and improved experience? And so I would invite any of the panelists to respond to this question. How do we use AI support? How does AI support the workflows for transitional care models that support patients and family engagement and improved experience? Any thoughts from any of the panelists on that?
Hi, it's Connie. I can go first if that's okay. And I think that's a very valuable question. And I think it's very important that as we create our strategic priorities with the implementation of AI, it's also important to think about how we currently communicate between all sectors. So my response to that question is this is an excellent way to have all health systems communicating effectively without having mediators in the middle. So acute care can speak directly with clinicians and frontline service delivery on how to transition a patient out of the hospital and back into the community or long-term care, wherever they are going. But to have that communication and that sharing of clinical information directly between all frontline providers.
Yeah, I'm just going to weigh in around the transition, specifically the transition I know the most about, which is from acute care to either transitional care to home care to long-term care. And one of the challenges I think that we that in a busy hospital sector that we have is sometimes better anticipating the actual timing of the progress of the patient and when that patient or resident will be actually ready to go to the next step. And I think AI and some of those decision-making algorithms could help us with that. which then helps us get our planning done well in advance and then helps to have a smoother transition. We've been working on some programs at Southlake where we're doing that using our noggins, and we're pretty good actually, but I think we could probably make that faster and easier with AI potentially, if they are populated, though the algorithms are populated correctly.
Thank you, Arden. Esther, did you want to weigh in?
Sure, thank you. So
Yes.
for me, this goes back to what is the problem we're trying to solve? When I think about transitions, one of the challenges that we see in public health are new parents, new moms, new dads with a newborn that's really struggling with issues around housing, support, isolation, breastfeeding. So in terms of workflow, how can that be built in? Maybe it's about doing sort of discharge planning in advance of that. So we can get all our ducks in a row and really engage clients in the process to identify what the need is, what is the key issue. I mean, that can really, I think, facilitate the transition and possibly, lead to some of the much better outcomes. I feel as a public health nurse, we're often trying to catch up with these new families postpartum, particularly those that are facing extraordinary challenges in their life.
Thank you, Esther. We have another question that was posted. The question is, well, first a statement, complexity is across sectors, and how do you see AI linking the patient's experience and the health team? So how do you see AI linking the patient's experience and the health team? Any thoughts?
So maybe from an acute care perspective, once again, I guess, certainly in, a lot of the literature that I've read and some of the experiences that I know that my colleagues in other hospitals are having, particularly I think in some of the US hospitals, is that they really are starting to use AI as sort of an early warning system. So right now, as I mentioned in my talk, we have early response teams that get called to, say, a medical unit, where they come in and they intervene with a patient that seems to be deteriorating. But remember that there's so much of the patient's deterioration that occurs before those overt signs of deterioration are evident to us. So I think, that's a way to link health teams into a swifter response to the patient so that we can prevent them from getting into, a deeper trouble and potentially into a point of no return
Right.
in terms of their physical condition.
Yeah,
That's
right.
one that just occurs to me right off the get-go.
Mm-hmm. Right. There have been a number of comments that speak to how important it is to prepare the practicing and future nursing workforce for this digital healthcare transformation. So the simple question around that is, how can nurse leaders support and lead this? What can we do as nurse leaders to ensure that the future nursing workforce is prepared for this digital health transformation?
Hi. Okay. And so my opinion on this is to start from the very beginning when you're developing your strategy, and that's where nurse leaders will be very important to support other clinicians to make sure that if there are committees reviewing or developing a strategy, that there are frontline nursing care providers on every committee as well as patients. And I think that is the best way to begin understanding what that frontline clinician experience is like and what it will take to operationalize any strategic plan that includes AI on the front lines.
Excellent. Esther or Arden, do you want to weigh in?
Sure. Thanks for that. It's a great question. I think from a public health perspective, I think really understanding what contributes to health and not losing sight of that. You know, we have nurses. I think nursing has to lead our choice in terms of what kind of data, what kind of data we're recording in the first place, and you know how we can't, and just as an example, we're collecting a lot of data on COVID, and with one exception, and that's about racialized populations, the populations that are most impacted by COVID. So I think that is a huge contribution that nurses have to be ready for, and that just fundamentally, I think we need to really prepare our future workforce in truly understanding social determinants of health and barriers and marginalized populations.
Yes, great. Thanks, Esther.
And
Do you want
I will, final word on that. I would say, that we haven't been incredibly great in the past in anticipating the changes until they actually arrive. And that's just because, again, change is hard, but also particularly when it is a change that that changes a person's own role. People get very married to their roles, and it's hard to change that sometimes. I think that we're going to have to start those changes early on in nurses training so that they're fully prepared for the kinds of supports. But I want to go back to what Esther said, which is what are the problem we're trying to solve? So we should only institute AI if it truly can be shown that it improves quality or that it helps us deal with a significant skilled nursing shortage. And we think we're going to have a skilled nurse. We've already got a shortage. That's probably going to continue based on the demand in the system. And so, you know, those are the kinds of things we have to start with. And so if the goal is how can we use AI to help to compensate for some of that shortage by taking away some of the things that nurses are doing now that we think AI could help with, well, then that's the way we have to try and lead the change, and we have to educate people around this is why we're doing it and this is what the end game is. And on the opposite, if it's all about quality, then start with where the quality gaps are and then be clear about how AI can really make a difference in that. I don't think we're going to get anywhere unless we kind of start with why.
That's great, Arden. Thank you. We've only got 4 minutes left. I can't believe that. This has just flown by, but there are a couple more questions on the chat group. I know I had some questions too, but I want to allow the audience to ask their questions first. So the first question is about, ensuring the engagement of frontline clinicians. So the question is, in your experience, how often are physicians chosen over or instead of nurses? And then how do we get nurses to the table, particularly considering that nurses make up the largest workforce body in healthcare? You know what? I think that maybe Arden, I'm going to put you on the spot and start and weigh in on this one for us.
Yes. I think that there probably is still some outdated, perhaps rooted in a certain amount of sexism, but I think perspective that somehow physicians are more technically oriented and would understand it more. That has not been my experience.
Yeah.
I think we just have to fight it like we have to fight all kinds of different gender stereotypes. And I think we've kind of got the same thing going on here.
Yeah, I think, Arden, my experience is very similar. We actually have an approach here where we don't initiate any change in our technology unless we have all the stakeholders at the table, and that includes nurses, physicians. I mean, it could include clerks. It includes anybody that needs to be at the table. So I think that though, the point around it is that as nurse leaders, that it is our role to advocate to ensure that the proper representation is around the table. And so thank you for that. I do have a question that I'm going to take the liberty of asking. And it's really about something that actually Arden said and Esther alluded to, and it's about the integration of AI technology for the sake of technology. And we've had lots of conversation here at Humber about that, technology for the sake of technology, in trying to develop a very principled approach, as Arden suggested, where we look at how that technology will impact our providers and impact our patients and families. And if it brings value in terms of quality and safety and those sorts of things. So the question that I will pose to all of you is that, given that we have, as nurse leaders, recognize this, how do we safeguard in our organizations against the integration of AI technology for the sake of technology? So what do we do to influence that? How can we influence that? Esther, do you want to start?
It takes courage. That's the first thing that comes to mind. Technology is front and center in our Board of Health strategic plan. It is part of the direction of local governments. It really is seen as as a panacea for a lot of solutions. I think that we go back for our organization. I use our principles and our values for going back when we're in the initial stages of design and development. And that should really guide our decision making and ensure the voice not just of practitioners, those at the front line, but also the voice of clients is part of the process. But it takes a lot of courage to challenge. Like, we get very swept up with the functionality and totally lose sight of what it is we're trying to solve. And then we don't even evaluate it because we're so excited that Google and Apple have stepped forward to hand us a solution without any cost. And we embrace it. And we don't even know what it's doing. And they just they give us oodles of background and telling us how it's protecting privacy. We get so swept up on how great it's protecting our privacy, but no one asks the question. What's the purpose? What's the problem? What are we trying to do? How is the population going to be better off? And that takes courage. And that's again, courage pointing to values of your organization can help. Sorry, I went on there.
No, thank you, Esther. And you look like a woman with courage.
May I add a couple of comments about that? Do we have time?
Of course, okay. Yes, please go ahead.
So in the home care environment, the business model that we operate under is a fee-for-service model. So we don't have funds sitting around that can be put into AI. And any projects that we take on that include artificial intelligence, and one big one has been in the wound care field, has to clearly demonstrate positive health outcomes for our patients and improve the workflow for our staff. So it's unfortunate that we're at the mercy of our funders to implement new technologies and to be able to find funding to do so within the home care space.
Thank you, Connie. All right, well, again, let me say my sincere thanks to each of the panelists for your very sage and insightful comments around this topic. I know I certainly have learned a lot today, and the dialogue was certainly very engaging. I have to be the one that says that this session is over, even though we have lots of people that have lots more questions and are very interested in this topic. But I'm sure that given RNAO's role and MI's role in all of this, we're hoping to hear more. So thank you again to the panelists. Thank you to our wonderful audience who made so many great comments and asked so many great questions. We, of course, invite all of you to stay for the next session, which I know will be just as interesting and inspiring. Thank you all so very much.